Actress Olivia Munn is going public after being diagnosed last year with an aggressive form of breast cancer and undergoing a double mastectomy. Nearly 250,000 women are diagnosed with breast cancer every year in the U.S.
Yeah, actress Olivia Munn co-starred on the HBO drama The Newsroom, and she's now raising awareness about a breast cancer risk assessment tool that's saving lives. Now, Munn says she would not have found the cancer for at least another year if her doctor did not calculate her risk assessment score. This is something doctors here at Novant Health say they've been doing for 20 years. Dr. Judith Hopkins is the co-leader of Novant Health's breast cancer program. She says all patients are offered a risk assessment who are getting a mammogram if they want it. The score is based on a woman's family history, the result of a prior breast biopsy, the age when a woman has her first period, and first child.
If they are interested, we will give them a risk calculation. And if their risk calculation is elevated, we will give them a referral to our high-risk clinic where they will be counseled about their risk and offered risk-reducing either medication or lifestyle changes.
Munn says that even though she tested negative for a genetic predisposition, the model showed she was still at an elevated risk, which is what led up to this early detection. Hopkins says it's important for all women to understand their risk. If you catch it in enough time, it gives you options. And Munn and Hopkins say they want that for any woman in the same situation.
I hope that Ms. Munn's experience will lead more patients to undergo risk assessment. And if they have a higher risk score, to undergo more screening with MRI in addition to mammograms, and perhaps more patients will undertake some of the medications that we have that can prevent risk.
And Hopkins there says about the age of 40 is what she recommends going in. Some other doctors say, 40 years old and do it every other year. She says every year just to be really on top of it. So.
Even when you're younger, I mean, if you are at that elevated risk, there's really no harm in going more, than you think you might need to, especially even at a younger age of, being at risk every year. I mean, just having it regularly checked up is always a good idea.
Yeah, it's good to always know the symptoms as well too, and just always listen to your body. Listen to your body. Your body never lies to you when you start feeling some weird discomfort. So just knowing what those symptoms are really important, and then going straight to your primary doctor as soon as you start feeling those symptoms.
And don't be scared to ask questions.
Yes.
I know a lot of younger, even when I was younger, I was always kind of scared to ask the doctor questions about me, who I am, how the body works. Never be afraid to do that.
There's so many more people that are asking the same questions.
Exactly.
So don't be scared.
That's exactly right.